Now we are going live. Okay, we tried this earlier today and it just didn't stream. So I'm just double checking that this is working. So we were to go live earlier today and I did a whole presentation and didn't actually go. So we're going to try it again. Hello and happy Friday. My name is Julie Hirschberg. I'm the owner, founder of Re+active Therapy and Wellness here in the Los Angeles area. And today wanted to share with you a little bit about the background evidence for integrated programs in neurorehabilitation. And I am going to share with you a few of the slides from a workshop that I did just last night for our clients at Re+active to talk about our integrated programs and how they work. And so I'll go through some of the slides just to share some of this background information and that really propelled Re+active to change from just providing physical therapy to really providing a whole integrated holistic program to empower people with neurologic disorders and complex health conditions to make real changes in their life. And this we have found through a really integrated approach that brings PT, OT, psychology. We're now adding lifestyle medicine, wellness, and care coordination to our care for people. So I'm going to give you a little bit of the roadmap of Re+active. And Re+active really started with me, and there's my kids as babies, just me and one person, actually one patient, and we grew pretty quickly. Within that first year, we added another PT, we added wellness programs, and already we knew there was a big need for really a comprehensive team for people. This is not new in neuro rehab. I worked in the hospital. I worked in inpatient rehab. I always worked on a team. I always had a speech therapist and an OT, a social worker and a psychologist and a physician that we collaborated with on a daily basis. And I loved that. And even working in some hospital outpatient settings, there was some of that team, not to the extent of being on the inpatient side. But for the most part, that doesn't really exist in the outpatient setting so much, and definitely not in a little tiny practice that was just me and myself and a patient. However, I did love this collaboration, and I was always working with folks with complex conditions. And I collaborated a lot with the group at UCLA. And it was in 2016 that we started a fellowship, now actually still the only neurologic fellowship in the world for physical therapists to specialize in movement disorders. That was a true part of a more collaborative nature of what we did. We had that fellow in the neurology clinic at UCLA with the movement disorder specialists. And we brought the movement disorder specialists to our clinics. The residents came, the fellows came. It was a great collaboration, and was the start of what's been really growing at Re+active. We've added OT, we had wellness. Last year in 2021, we added neuropsychology, and now we've got a team of 36 PT, OT, psychology, neuropsychology, yoga therapy, wellness professionals, lifestyle medicine, and we're hoping to add speech therapy as well. So we've got quite a team. And this did really grow from a distinct patient need for services, but I'll also what I really wanted to share today was some of the research evidence that inspired a lot of this. So this example, I've shared it before. I absolutely love this study from 2015. It's a group out of Italy, and basically they took folks who had Parkinson's, and did 28 days of multidisciplinary rehab once a year for 2 years. And what you can see in this bottom line here is that this is actually levodopa. So this is the medication that most people with Parkinson's take. And then this is the dosage. And so over the course of 2 years, we can see a distinct difference in the dosage of medication that folks took. Those who were in the multidisciplinary rehab didn't need to take as much medication. This is really big because, yes, those folks also improved their function and had less motor symptoms and overall were better. But to me, the fact that they needed less medication tells us a little bit maybe about their disease progression. This got me really excited to do something different. Doing this kind of multidisciplinary rehab, though, when it's just yourself or maybe yourself and another PT, is not really possible. We needed a team to do this. And I want to emphasize, so this got me excited, but I didn't just go out and open a rehab center and do this, right? Because there are also other ways. And I really love this article recently. I don't know if you all have seen this. Miriam Rafferty and colleagues from 2022 showed that there's many ways to do this. But what I really point out here, these clinical process facilitators, care coordination, team meetings, communication, interdisciplinary, but that it's person-centered. So there might be different ways it looked. This center one is a little more intensive model. This is a little more consultative and preventative model. This might be where we're doing some more maintenance level of care. You can see there's different frequencies here. Maybe this is once a month. This is maybe every day for a few weeks. So there's lots of different ways to do this. And I do think this is different. This is really important. This is important to reactive to provide what a person needs at this time point in their life. Now, I've got to share a couple more studies with you because I love these as well. This is one that inspired me in focal dystonia. Early on, when I started Reactive, I went to a course on dystonia led by Nancy Beal, who was a pioneer in this area of treatment, and she and her colleagues did a small study on people with focal hand dystonia. And again, I just want to point out the intensity here. They didn't just totally just make this up out of nowhere. This is driven by the principles of neuroplasticity, that intensity matters. What they looked at is 3 hours per day for 5 days a week, and then for 2 weeks, and then 5 hours per day for a week. This is a lot of practice. Now, some of this was on their own in individual and group therapy, and a huge lifestyle component. This is what our OTs do: sleep, diet, brain health, cognitive exercise, aerobic exercise, and the individual therapy, all important components. And 70% of those folks improved. A lot of them have musicians in dystonia, so their function, performance, and speed, all very important, improved. And the more they adhered to this program and protocol, the better they did. So this really spurred me on. I've been working with people with dystonia since I started Reactive. And for the most part, it was really hard to get this kind of intensity, particularly when I'm a one-man show, right? So as we've grown our team, we've now been able to have people join us for an intensive integrated team approach of therapy every day, 2 to 4 weeks, to improve dystonia symptoms. And it does really make a difference. Now, if you watch my videos, you know I talk a lot about functional neurologic disorders. The overwhelming evidence in functional neurologic disorders is that it takes a team. Now, there is evidence too that physical therapy can be very effective, but for most, from an inpatient, outpatient perspective, and now all our great rehab colleagues have consensus statements in functional neurologic disorders. This is where people get better with a team and potentially with an intensive approach. But again, there's other models that are effective as well. And then finally, I really love this study that this group put together. I saw them actually present this at CSM, I believe. Gosh, I think that was 2019, just before the pandemic. And what you'll see here is that they did a combination. So again, I'm going to say team effort. They did 45 minutes of exercise and then did the task practice to improve people's arm function after a stroke. They did 2 types of exercise to compare them. Voluntary exercise, in at the pace that you feel comfortable doing, versus forced exercise, biking at a forced speed and aerobic rate. And you can see a big difference between forced exercise and voluntary exercise. And that was significant in improving people's motor function in their arms. The key points here were to get to that 68 to 80% of heart rate reserve and at a high cadence. And it's a pretty high intensity too. 45 minutes of this for 3 days a week for 8 hours seemed to provide a golden window of opportunity and for neuroplasticity for upper extremity training. So again, not PT only, and this is a team. I shared this last week, so I won't go into it, but this past year, we actually ran a program that had OT exercise psychology for people newly diagnosed with Parkinson's, and also really had some great outcomes. This is why we have really moved to having an integrated programs, not just for the diagnoses that I showed the research for, but for many other neurologic and complex conditions where having a whole person approach is so important. So I'm going to stop sharing here for a moment, and I'll check in and see. Well, thanks for joining me live, because this is not the time I was supposed to go live. But you've got questions or comments, feel free to put them in the chat here. And what I wanted to share was our website. So we provided this workshop yesterday, and a lot of our current clients were really excited about the opportunities that are growing at Re+active. And so we've updated our website to make this a little more clear for people. And if you're a healthcare provider, by the way, I really want to hear from you and how you're doing this. I think we learn a lot from each other, but particularly for our folks coming to Re+active, there's really 2 ways to join us. People can come right into an integrated program. They know they want the whole team approach to neurorehab and simply click on apply now. We have some people really coming just looking for one specialty. Maybe that's PT, OT, maybe it's psychology or exercise and wellness programs. And they can also just go right in and join that individually with a provider. And in that case, we have people get started here. And this is new for us, and it's launching next month in August. And that is as people join us. There's a nice little video of me. We have an annual practice fee for access to this collaboration and communication with our integrated team. It also provides for our wellness services free of charge for classes for the first month. So we have had, although we've just put this out there, we're launching it in August. We've had people sign up because they're pretty excited. They get a free month of our wellness classes, which for our in-person and unlimited classes is actually worth a lot more than this annual practice fee. So that's pretty exciting. We wanted to lower the bar for entry into our wellness services and have them more integrated. And we're going to be able to do that through this practice fee. So we are different is what we're telling people. We're a different type of practice. We provide integrative, innovative care. We work really closely with each other as professionals, as well as professionals outside of Re+active. We have all the services under one roof, providing therapy together for the whole person. And we talked through last night with our clients too, how we're different than some typical practice, particularly in providing neurologic specialty care. So I'll stop sharing my screen, but I just wanted to show you that this really evolution from what really was me and one person to a whole team providing a really holistic approach. I'm really proud of that. I'm proud of that team, and I'm really proud to be a part of doing care differently for people with neurologic conditions and complex conditions, um, and that people have access to not a piecemeal approach, but to a full team to get the care that they deserve. So I wanted to share that with you. Thanks so much for joining me live, especially when I was supposed to go live earlier today and that didn't go through. So I'm on here sharing with you again. If you're not already part of our newsletter, I'll send out all the video. I'll send links to those articles as well. We send those out on Friday and on Monday. We have two different newsletters. One, if you're a person with a neurologic disorder, you can sign up at reactivept.com. If you're a healthcare provider, we'll send those out today, and you can sign up at reactiveeducation.com. And as usual, I love hearing from you, hearing your questions, and hearing what you're learning and doing too. So thanks so much for being a part of this community. I appreciate it so much, and I hope you have a wonderful weekend. Thank you.